Hi everyone, so glad you're here with me today. My name is Shaya, student midwife, and today I want to talk about something that doesn't always get enough attention in early pregnancy, but can make a big difference in how you feel both during and after you have your baby, and that's your pelvic floor. So first let's start with what the pelvic floor actually is. So your pelvic floor is a group of muscles that sit like a supportive hammock at the base of your pelvis. These muscles help support your uterus, your bladder, and bowel, and they play a big role in bladder control, bowel function, and sexual health. So during pregnancy, even like in those early weeks, your body begins to change, obviously. Hormones like relaxin start to soften your connective tissues, and as your pregnancy progresses, there will be more pressure on your pelvic floor. And that's why prevention, starting now, is so important. So the question on your mind might be, what can I do in early pregnancy to protect my pelvic floor? Well, let's start with awareness. One of the most important steps is learning how to properly engage and relax your pelvic floor muscles. Many people have heard of Kegels, but not everyone is doing them correctly. And it just as importantly, not everyone knows how to fully relax those muscles. Like a healthy pelvic floor needs both strength and it needs flexibility. To engage your pelvic floor, think about lifting the muscles you would use to stop the flow of urine or preventing passing gas. It should feel like a subtle lift, not a clench in your abdomen, thighs, or glutes. Like hold for a second and then fully relax. That relaxation phase is just as important as the contraction. Next, we'll talk about breathing. So, your breath and your pelvic floor work together. Practice taking slow, deep breaths where your rib cage expands and your belly softens. And as you exhale, your pelvic floor naturally lifts. So, this coordination helps prevent unnecessary strain and supports your body as it changes. Another key part of prevention is avoiding excess pressure on the pelvic floor. So, like trying not to strain when you're having a bowel movement, keeping your stool soft by staying hydrated and eating like lots of fiber-rich foods that can really help. And when you're lifting something, even like something that's not very heavy at all, it's important to exhale as you lift rather than like holding your breath. So holding your breath can increase pressure downward onto the pelvic floor. Posture also matters. Working on my posture now. Standing and sitting with a neutral spine, not overly tucked or overly arched. It helps distribute pressure evenly and supports your pelvic floor. And lastly, I want to emphasize that you don't have to do this alone. Like seeing a pelvic floor therapist during pregnancy, even if you're not having symptoms, can be incredibly beneficial. They can help assess your individual needs and guide you with personalized exercises and education. So, overall, taking care of your pelvic floor early in pregnancy can really help reduce your risks of issues like urine leaking, pelvic pain, or prolapse later on. And it also sets you up for a much smoother birth and postpartum recovery. So I thank you so much for taking a few minutes to learn about this important part of your body. And if you ever have questions or want support, do not hesitate to reach out to me. Your body is doing amazing work. Let's support it every step of the way. Thank you.